Welcome to this health webinar. Today it's time for presenting the results in our big health survey on people's perceived health and work-life health. After that we will have a discussion with a panel of experts on personal risk and health, representing IF in Norway, Finland, Sweden and Denmark. My name is Kristina Ström Olsson, and I'm a Nordic Health Strategist at IF, and also for a year now heading the personal insurance commercial in Sweden. And before looking at our results, here come some greetings from Morten Thorsrud, CEO at IF.
Hello, and a warm welcome to the IF Nordic Health Report Webinar. And in particular, a warm welcome to all of you customers and partners that attend this event. This is the second time that we at IF launch a Nordic Health Report, but it's the very first time that we also arrange a webinar like this as part of the launch event. So warmly welcome to this first edition of this webinar. At IF, we are spending a lot of time working on sustainability, and we have structured our work around a set of commitments to different stakeholders. So we have defined a set of commitments to the customers, we have defined a set of commitments to our employees, and we have defined a set of commitments to society at large. Health and well-being is one of UN's sustainability goals, and it's also one of those areas that cut across these three interest groups, as it has an impact both on you as customers, it has an impact on us and our employees, and it has an impact on society at large. And as always, the best thing, of course, is to try to avoid that the negative things happens. So a lot of the focus, of course, is to see on to look at how can we ensure and try to prevent that illness and accidents actually happens. That will be an important part of the content in this webinar. I hope that you'll find it useful and inspiring, and again, warmly welcome.
Yes, and now it's time for the results. Are you ready? And please feel free to ask questions in the chat during this webinar. Yeah, let us just look shortly at some figures that could be good to know, because this is experience from the healthcare insurance, and we have more than 300,000 people that has healthcare insurance, and we handle about 100,000 claims each year. 93% of our Nordic claims are handled within 24 hours. And customer satisfaction is 9.5 in 10. And the basis for this study is that IF's Nordic Health Report is based on responses from 4,013 people at the age of 18 or older. And as you see, we have more than 1,000 respondents from each country, Sweden, Norway, Finland and Denmark. And the results are weighted for gender, age and location to represent the population's attitudes. And the purpose of the study is to reveal attitudes to stress and work-related health in the Nordic countries. The data collection has been made by Kantar as web interviews between the 24th of January and the 5th of February this year. So let us dig into the results. The first part is regarding perceived health and stress levels. And as you see in the, firstly here, do you experience negative stress? In that graph you see that 88% of the population experience negative stress to some extent. That is an increase since last year, where it was 84%. We also see, when asking these people if they have experienced stress for a longer period, that means 6 months or more, 52% of those has been stressed for more than 6 months. And we see that women are worst hit here. 2 in 3 have problems with sleeping because of this. So that is a main symptom, I would say. You usually see that as an early sign when you get trouble with sleeping. And we also asked about the main trigger for this negative stress. And we see that both private issues, 9 to 29%, work-life balance, 27%, financial situation. Their own financial situation is the main trigger for 22%. And also work-related issues are a stress trigger. And with negative stress, we mean stress that is affecting life quality and well-being and workability in a negative way. We also see that work-life balance is a huge issue in Norway, compared with Finland, where the financial situation is the biggest trigger. When going into this new normal we have with the hybrid work life, we can see that it's both something good and something maybe not so good. And we see from those working from home partly that 56% feel that their perceived health has improved. Only 7% say it has been negative for their health. Still, we also see when asking about this stress that people working from home are to a larger extent experiencing negative stress. And that works both for the short-term stress and the long-term stress. And regarding employee responsibility and what kind of support that the employees need, we see here that 4 in 10 experience problems with their mental health that has been affecting their workability in a negative way. And when experiencing negative stress and mental illness, where do they turn to, the respondents? Well, 18% turn to the manager and 47% to the doctor. And of course, it's good to meet the professional in an early stage to get the right help. But we see that 16% don't seek help at all. Last year, that was 26% not seeking help at all. Of course, that is not good at all. So here we see an improvement in the results. We also see, when asking if you got sufficient help from your manager, only 1 in 5 think that they got sufficient help from the employer when suffering mental illness. We also see that 24% of the respondents say that they have experienced demeaning treatment at the workplace for themselves or for a colleague. And that is, of course, not at all good. We'll come back to that. And we also see that 35%, they are concerned about getting ill and being on a sick leave for a longer period. And that is also worse than last year, I would say. Pretty high increase in the number of concerned people here. And we see that pretty many employers are contributing with supporting physical activity at workplace, 44%. But 1 in 4 of the employees do not use it at all. When it comes to the welfare systems, we can see that there's a hard pressure. We know that from demography and the financing of the public healthcare systems, and we see that the trust is wavering. So when asking the questions regarding, do you trust in the public healthcare to help you fast when you're in need for specialized healthcare? We see that almost half, 46% say, yes, I do. On the other side, 42% say that they do not trust the public healthcare system to be there when they need it. And we see that the trust is lower in Sweden and Finland and a bit higher in Norway and Denmark, but it's not a very big difference. We also see interesting signs of that public sector employers have lower trust in the public healthcare than others. And we see that 44% say that they're willing to pay extra for health services that could prevent illness. So that is an interesting sign that we also are going to dig deeper into. So the key findings in the survey is that we can see increased stress among people. It's a trend that is reinforced, and also the prolonged stress. And we can see that health in a hybrid work life, it's here to stay, but it's also a challenge, and it's challenging both for the employer and the employee. That it's improving perceived health, but also a stress factor. But we also see, because we know that the employer's responsibility is far-reaching, that also employees need more support than they get. And we can see that the trust in the public healthcare is wavering, and many are willing to pay for services that could prevent illness. Yeah, so that was the results. And now it's time for our discussion around this. And of course, we see it's a kind of a lot of issues, challenges, and doesn't look so positive, because you see most of the findings are reinforced from last year. So it's kind of a negative trend when it comes to stress and perceived health. But we think that is why it's very important to also lift this, to raise awareness and to increase knowledge about it, so we can find the solutions together here. And together here with me today, I have the expert panel, and we have Michael Niemann. He's the senior underwriter, employer benefits in Finland. In Denmark, of course. We have Jarkko Kantoluoto, the personal insurance head for commercial in Finland. And we have Tobro Wøien, our psychologist at If in Norway. Warmly welcome. Yeah. And we see these results here with the increased stress levels. 9 in 10 experiencing negative stress. What do we think about this?
Yeah, I have to say that this is really worrying, and the rate in Finland is even higher, namely 92%. So that is an indication of something. Yet at the same time, I feel it is quite surprising that we are so stressed, still living in countries with high living standard and high social protection. But I can see why the stress is there. But for me, at least, one worrying finding is the amount of prolonged stress and its implications to person's ability to work, and that is one of the alarming things in this report. But at least obviously in Finland, the constant negative news about the healthcare cuts and the public financing crisis and the unfortunate war ongoing in Ukraine, they have an effect on people. But I feel that in this report we have very good and interesting and concrete topics to be addressed on how we can mitigate the stress that we have in our lives.
Yeah. And Denmark, the second happiest country in the world.
Yeah.
What do you say?
Well, we are happy in Denmark according to the World Happiness Report, but we are still stressed. What worries me the most is that the level for long-term negative stress has increased by 58%, according to the report. So let's see which place we are in next year.
Yeah. And Thomas, as a psychologist, that if you have a lot of insights in this, are you surprised?
Well, I'm not really surprised, I wouldn't say, because we've seen statistics and also the previous health report showing us that the numbers have been high over a few years now, and we also see in Norway an increasing amount of people in need of psychological treatment in general, and also through the healthcare insurance. And we know that being exposed to prolonged stress may increase the risk of developing mental health problems like anxiety and depression, and such conditions are now also the second biggest cause of sickness absence in Norway. So not really surprised, but still a bit worried though.
And it's the same in Sweden, I would say. We have never had this many people on sick leave due to stress. So it's concerning. And I wonder, we have gone through a pandemic. Could it be that we are more sensitive to stress than we were before?
Maybe. I think it's a bit hard to say, but a recent PhD in Norway have been looking at the mental health after the pandemic, and the findings are that while it seems that most people managed well after the restrictions were lifted, I think around 7% developed more lasting and serious problems with depressive symptoms. So, and it seems like feelings so helplessness and loneliness were prominent among this group, and it may be that stress due to both financial worries, but perhaps especially lack of social support may have been contributing to this picture.
Okay, yeah. And then we have the extra layer with the prolonged stress. We see then an increase from 40 to 52% since last year that has experienced prolonged, been negative stressed for more than 6 months. And of course that's a real issue, because we see that the symptoms on that will be like maybe pain and other physical symptoms, but also mental symptoms and increased risks for lifestyle-related diseases, but also long-term sick leave. So the early interventions will be here very important, because we know that we can remove a lot of the problems when it comes to both the big suffering that it is for the human that is affected by negative stress, but also how costly it is for the employer with sick leave and missed opportunities in the business. So there is something to think about. And the high sick leave rates, they are even higher in Norway than they are in Sweden.
Yeah, they are.
What's
I think we see a kind of an alarming trend there, with not only the sick leave rates are high for mental health problems, but also we see the amount of people on disability pension due to mental illness is now increasing more than for any other group of diagnosis, and disability due to mental health problems typically also occurs at a younger age. And in Norway now it's causing more lost working years than the whole group of cancer and cardiovascular disease altogether. So what worries me the most is that a substantial part of these, or amount of these cases, kind of starts as what we call common mental health problems, like milder anxiety and depression, where a full sick leave generally is not recommended from a medical point of view. There's massive evidence from research that this group should get quick support to stay at least partially at work, as this will also speed up the recovery process. So I think there's a great potential for prevention at the workplace, focusing on or having a good psychosocial working environment and good support from your colleagues or from your manager will work as a buffer against work-related stress. So I think prevention at the workplace should be kind of a shared responsibility between the employer and the employees. It could be about focusing on the psychosocial working environment, could be focusing on physical activity, but also just about supporting each other and being inclusive.
Yeah, very important, very interesting. We also see Denmark, you have lower levels when it comes to prolonged stress, but still an issue.
Yeah, second happiest in the world on low sick leave. Then can we then conclude that Danes are healthier than others? No, I don't think so. One of the reasons that we have those low statistics could be that it is easier or quicker to dismiss an employee in Denmark, and that can prevent some of them from asking for a sick leave. On the other hand, Danes have the highest perceived health level compared to the other countries. Right now we are seeing from employer side that they are focusing on a healthier work environment and also preventive care. So that could improve the things.
That's good, yeah. And we see in Sweden, I think maybe most interesting here also is that we have quite big disparities between women and men. And it's 70% of the women that has experienced prolonged stress now. And the younger the people in Sweden, the more stress, both short-term and long-term. So that is something that we have to keep an eye on, I think also. When talking about the main stress triggers, it was really interesting to see that Finland, there's a really high level of people thinking that private issues and financial issues are the main triggers.
Yeah, that is a really interesting finding, and what we see from the results is that Finns are more worried about their financial well-being and situation, and the stress level is also more depending on the income and education level than in other Nordic countries, which is some sort of like a difference. We Finns are stressed because we worry about our financial situation when and if something happens. And Finland has the lowest average income in the Nordics and highest unemployment rate. So this may at least partially explain why the financial situation is a prevalent stress trigger for Finland, at least compared to other countries. For example, in Norway, that is lower than in Finland.
Yeah, I think it's quite interesting to see the difference because, yeah, as you say, the survey shows a completely different result in Norway. Yeah. While 36% of Finns say that their main trigger for stress is their financial situation, it's only 9% in Norway saying the same. So, but still, I think even though it's not the main stress trigger, we know that many Norwegians also have financial worries these days, and of course we know that financial worries may have a big impact on our quality of life.
Yeah. And we see also, I think that is an interesting discrepancy between maybe Norway and Sweden and Finland, that we don't see any big difference between income level and education level. They are about the same, have the same stress level, but it's a really big difference in Finland. And we also see that 35% of the people, they are kind of worried about getting ill and need to go on a sick leave for a long period. And there we also have more concerns in Finland than in Norway. So I suppose there's a connection between the financial worries and this number as well. When talking about the hybrid work life a bit more, and that it's a challenge, we saw in the presentation that many that are experiencing a good perceived health from working from home, and we see that only 26% are working partly from home, but from them 56% say it's good for their health. But still, we see that it's affecting their stress level in a negative way, or depends on what is what, because it could be that you are stressed already and that is why you're working from home. Or could it be with its obvious benefits that we have with working from home, the flexible life, but also the hidden risks, such as blurring the lines between work life and leisure. What do you think, Jarkko?
Yeah, I think this is a very cool topic and also very interesting in a sense, so that so many persons answer that working from home has made their life so much better in many ways, which is very cool. But yet, and what you also said is that surprisingly at the same time, we can see from the answers that people working mostly from home are more stressed and additionally and worryingly suffer more from the prolonged stress that we just have lifted. So could it be that those persons are missing the life support from their colleagues? Or could it be that these people who mostly work from home, they need some sort of like a transition between work and leisure? And that transition could be something from having a short mindfulness session or just a short walk. But I think the key is that there needs to be some sort of like a transition so that you are not always working when you're working from home. And additionally, I'm sure and confident so that when and if you feel that you have to be always available, that is also increasing the negative stress, and that is something that the employers could address and create a culture of like where you don't have a culture of browsing through emails on weekends and on your leisure or in the evenings, and making a culture that is kind of like forcing people to have those red pop-ups blinking in their phones, so that then when they are on leisure, they are actually recovering and not basically being on alert. So I think this is a very important thing, and which the employers can actually address.
And also, it's more difficult for managers to calibrate with the employees, to spot the signs. When you work remote, that's more difficult. The managers has to cope with this, as this is the way we are working now and in the future. So we have to think about it.
Yeah, we know that the employer's responsibility is really far-reaching, and that it could be hard to, find the right dialogues and follow-ups and to set the right expectations. But I think we need to do this in this new work model that we have. What do you think, Thomas?
Yeah, I agree. I think one of the possible downsides with the hybrid working model is that it's more difficult for employers to assess and to follow up on how their employees are doing, and it may be more difficult to catch signals that something's wrong or something is causing stress. And it's like you said, it's the employers have a far-reaching responsibility here, but handling these risks when people are working remote requires much more fine-tuned caring attitude, I think, and also skills to pick up signals that something is wrong. Yeah.
So this is the employer's role in this?
Yeah, I think we have a bit said about it, but the employer responsibility is really, really far-reaching in all Nordic countries.
Yeah. We have, for example, we have working environment acts in all countries stating that the employers are obliged to ensure a safe and healthy and actually also health-promoting working environment and protecting their employees against potentially both physical and mentally harmful effects, and to provide them with the support and adaptation according to their needs when they need it. So I think employers should work with this in a systematic way. That will give the best results.
Systematic work environment work.
Yeah.
That's good. Yeah. And Michael, what do you think about this?
Well, sick leave can be explained in many ways, and in Denmark it can partly be explained that some of the employees simply falls out of statistics due to they stop working because of illness, and at the same time in Denmark they have a high perceived level of health.
Yeah, you have lower stress levels, but everything is a comparison.
Yeah, it is.
So
we still have long waiting lists.
You have.
Yeah.
So can we still be stressed and satisfied with life?
Yeah, absolutely, I think so. And also this year, Finland got the top ranking. You were second, but Finland got the top ranking in the World Happiness Report. So, and yet still at the same time, 92% of us feel the negative stress to some extent. But I think we Finns are very happy people, and in a sense, so that, or in these results, so that we Finns are satisfied with our lives, even if there is some stress related.
That's good. Let's all move to Finland.
Yeah, absolutely.
And when talking about the employer responsibility, I mean, we see that employees need support as well, and we see in the results that 4 in 10 experiences when mental illness, they think it affects their workability in a negative way. And we also see that is highest in Sweden and Finland. And when it comes to if you feel that you got the right help, only 1 in 5 receive sufficient support from the employer.
Yeah, I think this is a quite multifaceted thing, but this reason for, or the reason for that can of course be everything from not knowing about that the person suffering or the person is suffering because he or she hasn't told her leader about it, and but what comes through in this report is that the proportion of the Finnish respondents explicitly rejecting the support from the employer is as high as 30%, and is really high compared to, for example, what you have in Sweden, which was 18. So it is a big difference, and partially what we also said, but according to Kela, Social Insurance Institution of Finland, the astounding fact also from Finland is that mental health disorders are the main reason for having long sick leaves. And according to OECD, this is costing a lot of money for the Finnish economy. So I think we really, really have a challenge at our society with this. And this may also be partly explained by in Finns we have a little bit like a culture aspect of not asking for help, which we will hopefully develop away from. But I think the bigger reason then is that there is the stigma when you have been having or have had a mental health disorder. So people are fearing of kind of like having that stigma. People are fearing losing their jobs or being left out or having some sort of like a reputation in the company. And I feel that this is then implying that we should develop ways and the culture so that where we can reach out early rather than late, and then having a culture which is understanding what the mental health disorders are. And then I think one big part is that we as a society and companies treat the mental illnesses as like normal illnesses rather than having them some sort of like a whisper in the box or something like that.
That's good. And that would be a wish for all countries.
Yeah, absolutely, absolutely.
But Thomas, 1 in 5, that is few.
That is few, yeah. And I hope to see these numbers increase in the future. And I also hope that more people will turn to their manager when they struggle. I think I know from psychological treatment as well, that there's a huge potential in a good dialogue between the manager and the employees when someone is struggling mentally. And for people with these common mental health problems, it turns out to be far better to be at least partially at work than on full sick leave, as this will, as I said, speed up the recovery as well. So I think many employers these days are taking this very seriously and also are good at it. But still, there are a fair amount of managers who finds it more difficult to handle mental illness among their employees, and feel a bit insecure on how to approach their employees in the best way. So we try to support our business customers on this area, providing them with knowledge on how to support employees who struggle. And but then again, I think it's fair to mention as well that not everyone wants this kind of support from their manager, but still I think the survey shows that 40% would have wanted more support than they actually got.
Okay,
so,
that is important to bear in mind as well. So there are solutions, but you need to ask for it as well. It will not happen maybe. We also see in the findings that we have 24% saying that they were into demeaning treatment or a colleague to them. And unfortunately, it doesn't look very good for Denmark there.
No.
30% there.
Yeah. Yeah, and we are not proud of it, I would say. We are winning this competition. As you said, 3 out of 10 are experiencing demeaning treatment. These numbers should be 0. There should be 0 tolerance from the employer side against this. I also think that colleagues has a responsibility towards this, to spot the signs of demeaning treatment, talk to the manager again. And of course, the employer has an obligation to avoid this. A workplace should be a good and secure place to be for all people.
Yeah, definitely. And in Norway, there are some experts using the term ethical infrastructure to kind of highlight key factors that are important in preventing demeaning treatment. So an ethical infrastructure is about having both formal and informal systems to prevent conflicts and bullying and harassment. And formal systems like guidelines and procedures that are known to all employees are vital, as is also the climate and the culture at work, and also the manager's way of handling these risks in a very clear and consistent way.
It's really interesting, yeah. So as a summary, we can see that it's really important with the early interventions and the collaboration between employer and employee. And we're happy to see that more and more employers are investing in preventive efforts like the healthcare insurance that can help with fast access to healthcare, because we know that a long waiting time or also a long time in sick leave will be very hard to get back to work. So it's interesting what you're saying as well, that it can be good to get back a bit to work early to get the social connection and all that.
Yeah.
So that's interesting. And when talking about the trust for the public health care, we know that the welfare system is under pressure. Though in the Nordics we have great welfare systems in many perspectives. We have a comprehensive health care and also a quite great social protection, but we can't afford it. So, and we also know when it comes to demography, we're getting older, we need more care, but we are also more informed of what we can get, because we have really a high increase in technological development. So we will demand more. And we also see that the social systems are eroding, so it's not enough what we get from the public if we are into long-term illness or permanent disability. So we really need some extra security to get that. And when it comes to the waiting times and the trust, we see that 46% trust that they'll get the care that they need in time, but 42% doesn't. And at least in Sweden, we know that the long waiting times are a clear reason for the increase in demand for healthcare insurance. What do you think about this, Thomas?
Yeah, I think we have the same in Norway, where the long waiting times have been a challenge for years.
Yeah.
And there's lots of political discussions around this topic as well, and the need for more public-private cooperation. So, and If has been contributing to the discussion through, for example, the Norwegian Helsepolitisk Barometer, where we're suggesting that treatment through the healthcare insurance is a valuable supplement to the public healthcare, and also contributing to reducing the waiting times.
Yeah. Interesting.
Yeah. I think that consequently in Finland more and more people see the importance of what the healthcare insurance brings as extra security. And to give you also example is that currently there is even a discussion if the occupational healthcare should be renewed in Finland, and that is a little bit like a continuing the series of making people more anxious and also insecure about their future. And even if it sounds a bit corny to be said in this context, but I feel that this is actually a very good time for companies to have a proper and comprehensive healthcare package available for the employees, because through that I think people will be happy and motivated, and that is a great way to attract and retain talent also in the companies, so that you have the comprehensive package available and get your people or get your employees quickly to get help or when needed and when available.
Yeah, interesting. And in Denmark, we see, the waiting times are not so bad as it is in our countries.
Yeah, actually in Denmark you have a 60 days guarantee for surgery within the public system. And if the guarantee is not honored by the public system, you can go to a private provider financed by the public system. One problem here is that examination is not a part of it, and you need the examination before you go to surgery. Another fact is that almost 50% of the Danes has a health insurance, and that is a much higher level compared to the other countries. And of course this reduces the waiting list a little bit. Because the insurance companies are taking this part. But we still have long waiting lists, especially within psychology and examination.
Yeah. And that's interesting for all our countries. We can see also that almost half of the respondents, 44%, are willing to pay extra to get the health services that can prevent illness. So that is a really positive. Or maybe it's because of some issues with the whole healthcare ecosystem, but still it's good that there is a big consciousness that people want to prevent illness and thrive health. And as long as the long waiting times are there in some ways, at least in Sweden, an unpredictable healthcare system, of course we are there as an insurance company to support and to secure the gap between the social contract or public commitment and what people expect from it. And of course we support the comprehensive healthcare system in our countries. Yeah, so we have a lot of more insights also in the report, of course. And before wrapping up this seminar or webinar, can we ask if we have gotten any questions maybe in the chat? Yeah. Oh, I think we have gotten a lot of them. Let us take some of them here. Now a question will come here to no one specific, but on preventive health, do we see any signs of increased focus on this in public healthcare? Yeah, maybe I can answer or start to answer that one. And we see, of course, it's really, around different stakeholders in Sweden, we talk a lot about prevention. Prevention is what we need, because we will not afford or we will not cope with financing the public healthcare system in the future. So we really need prevention, and a lot of efforts are doing regarding investigations around this, but not much has happened. So we see also in the report that the numbers for preventive health services is very low in the public. So my short answer, I think, would be no, not really.
No. I would say preventive healthcare is a tough subject, because are you going to treat totally healthy people, or do you treat somebody so you avoid that things are getting worse?
Yeah.
And that's a good question, but we don't see any preventive health within the public system in Denmark today.
Yeah. And of course, we work more with primary prevention. We don't want the accident to happen. We don't want the injury to happen or the illness. But in the public system, they also look more to secondary. How can we prevent things to happen again, or the illness to get worse? So we need to work together on that one, I would say. We have another question. With these alarming results regarding stress as seen in the report, what would you say is the most important thing to do as a company or employer? Yeah.
I think that is a very good question, and I would say that good starting point is to start somewhere so that you know how you're doing. For example, in contrast with the results that we have been showing, so that how people are feeling, and also like have it like twice a year, so that you really know where you're developing, and then I think that is kind of like very good starting point, and then also kind of like internally communicate the stuff that comes up and make a podcast or something like that on the topic, so that you really discuss and take on the topics that come true, and then where you're going and what you're doing, because internal communication is really, really important in this one.
I also think that one of maybe the most important thing you can do as a manager is to make it safe for the employees to come to you when something is difficult or when something is causing stress. I think all managers should use kind of every opportunity to say to their employees that if something is difficult, please come to me, and I will do what I can do to support you and to explore solutions together with you. So that will be a good starting point, I think.
I totally agree on that one. Secure that you have an open dialogue with your employees in an early stage, so you not only discuss the results or the expectations on the work, but also how you feel, and so you get also the social context and the no stigma but trust between.
Exactly.
And one more important thing, I think, is that colleagues should be aware of each other. It's not all people don't like to go to the manager. Maybe they like to go to a colleague instead, and that should be totally accepted.
Yeah, that's good. And I see our time is running out. So firstly, I would like to thank everyone. I mean, Jarkko and Michael and Thomas for this, but everyone, we have had a lot of people involved in making this report, so it has been a true pleasure for that. And as the largest insurance company in the Nordics, we really would like to make a difference, and we do it in many senses, but one way for us is to make this report to raise awareness and increase knowledge for us all, and we hope for a positive collaboration together in the future. So thanks for joining, and take care.